It's really making it so recovery is easier, making it so these processes don't need rehab after doing them. Technology in medicine, and specifically our field, is advancing fairly rapidly. The field that I'm in, interventional spine, it barely existed 20 years ago. They've started to use image-guided processes instead of opening people up for these procedures where in the past you had to do a fairly large surgery. But now it's very possible to do things like a minimally invasive lumbar decompression, and I'm doing it through, a centimeter incision. And that's a procedure where people were having to open them right up to do these decompressions. So technology has resulted in something like that, where I'm able to use an X-ray guided approach so that I'm not having to do these bigger surgeries.
Yeah, I think Dr. Fallon and I are so lucky because we had the benefit of standing on the shoulders of giants to do the hard work of researching and developing, and through the research and developing component of, medical devices and, the instruments that we use are extremely sophisticated. And we have the benefit of now just using those, and it's just routine for us now. And I think that the more I'm thinking about it, the more I'm grateful for those people that have gone out to make it evolutionary, even when it wasn't maybe accepted.
In addition, there's all sorts of new stimulators that I use as well, where we're even stimulating muscles that we hadn't really even thought about in the past. So we know that strengthening the muscles of the spine are really important to keep that scaffolding, but the idea of stimulating these muscles to rebulk and regrow wasn't really even a possibility in the past. And now we're able to take a targeted approach through tiny, small incisions and put these stimulators in that can rebulk the muscle, which is kind of the beginning of the cascade that leads to all of these other spinal problems. And so,
same with chiropractic care. We haven't had as many advancements in technology. The one that we have right now, what I use, it really helps me just be much more specific, safer. It's more comfortable for the patient. It gives me real live data feedback that I can then measure change even before a patient feels change. Because if you think about it, when I do my care, I'm not really treating a symptom. I'm trying to care for the cause of a said symptom, which in my case, if they fit the patient profile here, is weak spinal muscles, decompression or compression, as he says, a weakening in the scaffold, constructs of the spine. This instrument will help give more computer-guided feedback that my hands can't feel. Like, this instrument can feel things I cannot feel, and it's sensitive up to like a hair width of vibration.
Other people much smarter and doing different research than us are coming up with all these solutions that we then get to use and take care of patients with. So it's really making it so recovery is easier, making it so these processes don't need rehab after doing that, because patients are getting older and older too, and they're more and more frail, but they still want to go play pickleball. They still want to go do their things with their friends and go hiking and things like that. But at the same time, if they have a spine problem, it used to mean, okay, this is it, because it's going to lead to a big giant surgery. And now we're able to get there with much smaller devices.
The technology it uses was developed by NASA like 35 years ago. It has like a little piezoelectric sensor, which is a crystal basically. And when you tap a material, whether it's this or the wall, it measures the sound of that vibration. And we all know that when a spine moves in its normal range, it has a very specific frequency that it vibrates at. This instrument can actually measure the vibration. I can see as each vertebra resonating at between 35 to 38 hertz. Not too little, not too much, not stiff and rigid, not flaccid. And that spine likes to be at a certain frequency to where it's stable. But of course it has limitations. So with advancements in this, I've been able to realize faster on a patient if I can help them or not, just by their response to it is semi-diagnostic, and we're not doing any harm in the process of doing it. So it's easier on me too. I could probably last longer as a doctor now, not leaning into people and hurting my shoulder, my back, which is kind of ironic. A lot of chiropractors, even surgeons, we have body problems. We're looking down, hanging our head over people all day long. And if I can get more longevity out of my career and help my patients have more longevity at the same time, I think it's very economic benefit to me and the patient.